All right, good afternoon, everyone. Welcome to our THA Workforce Strategies webinar. I'll kick things over to Andrew Burnett and have him start us off today.
Thank you. Hi, everyone. Good afternoon. My name is Andrew Burnett. I'm the Vice President of Workforce and Rural Health at the Tennessee Hospitals Association. Welcome to this THA Workforce webinar program series that we're completing over the course of 2024. We have many topics that we want to extend to our members and partners that pertain to best practices related to the recruitment and retention of healthcare professionals. Last week, Wednesday, January 31st, in our first webinar program of this year, we had the Chief Nursing Officer from UT Medical Center in Knoxville and the Dean of University of Tennessee's Nursing School to discuss academic and hospital collaboration to increase nursing school slots with partnerships with an employer. If you weren't able to attend that session, please reach out to us and we'll make sure that you receive the recording from that program. We don't have a scheduled program for March, but we will be sure to resume our workforce-based webinar programs on April 10th with a calendar invite coming your way soon. Next, I'd like to turn it over to THA's Director of Workforce Strategies, Farrell Thomas, as she introduces today's program and guests.
Thank you, Andrew. Good afternoon, everyone. Welcome to our second installment of our Workforce Strategies webinar, and we're going to focus today on work-based learning models, CTE programs, and employment of under 18 healthcare professionals. I'd like to take a moment for a few housekeeping items. Each of you were muted as you came into the session. If you do need to be unmuted during our question and answer time, we ask that you raise your hand, and Andrew and I will unmute and call on you to ask a question or provide feedback. We will have a series of presentations today. We have three groups of presentations to be exact, hearing from several different key stakeholders and program developers in this great field. And we would ask that you put any of your questions or comments in the chat or the question box. We will address all of those items at the end of our presentations again. And all of our content materials and a recording of this session will be available and distributed to those who registered for the webinar. And then we will also send out our webinar website found on the THA homepage that has all of our resources and a recording of these sessions and our previous sessions as well. Again, happy to have you here this afternoon, and let's dive in. So our first presenters are from the Tennessee Department of Education. Matthew Spinella is the Director of Work-Based Learning and Industry Engagement, and Dr. Elizabeth Norton is our Senior Director of Innovative Models. They're going to get started today and have a little bit of dialogue with you all and sharing of information instead of a presentation. So I will stop sharing and we will meet our panelists. Just give me 1 second.
Hi, everyone. I'm Liz Norton. I'm the Senior Director of Innovative School Models at the Tennessee Department of Education. Innovative School Models is a $530 million appropriation by Governor Lee and the General Assembly. I oversee the management of that large investment, which is about innovating and reimagining our middle schools and high schools to provide more workforce and labor alignment, to expand work-based learning opportunities, to expand students' access to early post-secondary opportunities, and to expand their opportunities with industry credentials. I'm going to pass it off to Matthew Spinella, who is our Director of Work-Based Learning and Industry Engagement, and he's going to tell you a little bit about what work-based learning looks like in our high schools right now, how you can find resources related to work-based learning, and how you can get started with work-based learning if that's something you're interested in doing. Matthew?
Thank you. So just to reintroduce myself, my name is Matthew Spinella. Yes, I'm the Director of Work-Based Learning and Industry Engagement for the Tennessee Department of Education. When Farrell had reached out to me and asked me to kind of explain a little bit about work-based learning models in the healthcare space, as well as the employment of minors in Tennessee across different industry sectors and specifically healthcare. I said, sure, I'll be more than happy to kind of walk you through kind of what it is, what we do. And I'll be very brief. Obviously, my contact information and links that I'll be showing you today are going to be available for your review afterwards. I'm always, open door in terms of who has any questions and follow up, knowing that we have some limited time here to speak today. So in terms of work-based learning in the state of Tennessee, the Tennessee Department of Education has its own website for work-based learning. We have information about what it is, email information. We have a mailing list in which we send monthly emails to kind of keep everybody up to date. That is not exclusive to educators. We have workforce intermediaries, other state agency partners, as well as nonprofits and obviously private sector businesses that are on these newsletters, and they kind of just keep up to date on things that are happening with work-based learning and so forth. Another thing that we focus on here is required documentation, which at this time you don't really need to focus too much on, but we do have some really good resources in here as an introduction to work-based learning. And then we also have a toolbox that is mainly for our partners in education, but also for our private business partners. So there are just some wonderful things. And again, the link to these websites is shared in the information that Farrell will be sharing with you. In terms of what you can do to participate in work-based learning in Tennessee, I think what comes across most people's minds of what work-based learning is has to do mostly with kind of like students going to work, leaving school, going on site, and either participating in some sort of extension of their learning through an internship where they kind of observe, do some research, perhaps put together a project that might improve the organization, perhaps conduct some training and upskill themselves kind of in a controlled environment. There's also paid employment in which they're doing the same work that anyone else in the business would do. And across the state of Tennessee, we have students as young as 16 being certified nursing assistants, CCMAs, certified, CPCT. And forgive me that I'm not too familiar with all of these acronyms, but across the healthcare sector, we have a lot of different industry credentials and professional learning experiences where the students are actually able to perform the duties of a full-time employee, either in a part-time or slightly more close to full-time capacity, especially over the summertime. And through work-based learning, if someone is 16 and 17 years old, there's a consultation process that we can offer. I do it in partnership with the Workforce Compliance Division at the Department of Labor and Workforce Development. So those inspectors that would go across the state and say, what is this high school student doing working in your business at this hour on this day? Shouldn't that student be in school? We're able to kind of walk you through what's necessary so that folks can do it. Don't want to take too much away from the districts that are going to be speaking. So I'm going to dive into some other ways that you can partner with districts. But first, we'll go through the definition of work-based learning in state law. So if we take a look over here, you can see that work-based learning means the application of academic and technical knowledge in a work setting that involves actual work experience. And a link to this law will show up. So what does that actual work experience look like? Does it have to be something that requires someone to perform the duties of a paid employee? No, we actually have a continuum of work-based learning experiences. And if I can just increase the size of the screen so you can see it, businesses actually do a lot of things that do not involve student employment, that do not involve paid employment. In the early grades, students might not even be familiar with some of those occupations in the healthcare sector that exist. No, a third grader doesn't need to know the difference or be able to differentiate between like a CCMA or a CNA, right? Or an LPN versus an RN versus a nurse practitioner. I'm 43 and I can't even do it, but they should know information about industry and career awareness, just that the healthcare sector exists. And there are a number of different activities that one can participate in if they like helping people. Whatever dispositional characteristics are necessary to succeed in the workforce, obviously in that industry sector, they want to focus on that. They can conduct informational interviews, job shadows, and even kind of like an ongoing virtual meeting, kind of like this, but more intimate between a professional and the classroom, so to speak. And that's how you can, peel the onion back and go from the industry and career awareness to career exploration, completed by perhaps a specific type of employee within the organization. The preparation obviously comes through a number of different things. We'll call them project-based learning. If a business can partner with a school and perhaps help students with kind of like ideas for what projects they can produce. A lot of them might just say, hey, here are some typical tasks that we would do in the professional setting. You as a school have already purchased this equipment to participate and practice these things. What kind of outputs can you do? How efficiently can you complete a task? How accurately can you complete an assessment? What sort of bedside manner might you have if you're going to engage with, let's say, a new employee or work at the front desk? And some sort of competition in which the business partners with the school to discuss more specifically how that looks and who has performed well according to a rubric. That type of engagement is mutually beneficial because the student will get firsthand feedback from a professional, but then the business can also identify this 10th grade student really looks like she or he has what it takes to succeed. Did that individual say that she wants to become an LPN one day? Maybe we can put her in a rotation at our hospital and have her take a look and observe what LPNs do through a job shadow. Or maybe we can even have her go and conduct a 9 to 12 week internship, or maybe even do a full-on work-based learning placement in her grade 11 and then more full-time in the summer of her between grade 11 and grade 12. So all of those options are on the table, and that's what leads into your career training. And that's what those internships, clinical experiences and such look like. The state of Tennessee has a number of different courses. Clinical internship is one, nursing education is another, emergency medical services is a third, and then lastly, the career practicum course, which focuses mainly on your employability skills and allows the student the greatest amount of time to participate in these placements. I know I'm kind of a little bit short on time, but one thing that you might ask, even though I kind of just said it, like don't just take my word for it, what I want to share with you is information about the consultation, and it's pretty straightforward. It all kind of feeds off of this law right in here, which outlines which minors are exempt from the Child Labor Act. And if you take a look over here, Part 11 is specifically where we talk about those students in a state or local education authority or in a course of study in a substantially similar program, employed under a written agreement, a copy of which must be retained by the employer in their personnel records. Those are documents that the Department of Education provides the district, which then the district fills out and the employer then signs. And so those agreements are provided by the Tennessee Department of Education to our schools. All you're responsible for as an employer is to review, make sure the information is accurate, sign to it, and then document any and all safety trainings that the student completes as a part of the placement, which you might already do in your existing HR practices. And thus you can just print off those records and attach them and allow the school to maintain those records simultaneously. So that's kind of the long and the short in a nutshell. I do want to pass it off because I know that we have other speakers that are going to be going and talking about their individual programs. So I'm going to stop sharing my screen and I will let Farrell take it from here.
Thank you so much, Matthew and Dr. Norton. I appreciate you sharing all of those great resources. Next up, we have a couple examples of programs that have been developed in coordination with high school CTE programs and healthcare programs. So first, I'd like to introduce our members from Lenoir City High School and the CTE program, as well as Fort Loudon Medical Center. They're gonna share with you all the structure and how they kind of came up with the Patient Care Support Assistant program. And I will get started. If you all will just let me know when you'd like for me to advance to the next slide, we'll get started.
Hello, I'm Mark Weeks. I'm the CTE director at Lenoir City Schools, and I would like to introduce Jennifer McCombs Cleveland and Tammy McLean. We have several health science opportunities with Fort Loudon Medical Center that have opened up over the last year or so that weren't there before. We, like most school systems, run into issues with employers not wanting to hire underage students. And so Tammy and her crew have created an opportunity for our kids, and I'm going to let the experts kind of explain what we do.
Jennifer, we can't hear you.
Okay, sorry, thank you.
Yes, ma'am.
As a teacher nurse, I'd like to take a minute just to give you some background information on how we prepare the students for these early career roles in healthcare. That way, when you're considering hiring them, you'll know what level of preparation they have. If you can flip forward 2 slides for me, please. Thank you. All right, students can select several courses which they build into different pathways. The courses are part of the college, career, and technical education program through the State Department of Education, and chances are your local high schools will be offering some of these options as well. We start with a foundation of skills and knowledge in safety, HIPAA, infection control, and more in 9th grade health science. In medical therapeutics and medical diagnostics, we focus on therapeutic and diagnostic career skills, as well as building mastery of those concepts and skills they learned in health science. In anatomy and physiology, students learn all of the body systems, how they interact, and the appropriate terminology. After that, students choose their capstone course. Nutrition science focuses on nutrition and dietetics, which might blend seamlessly into a dietary aid position. Clinical internship allows students to shadow various healthcare careers, identifying areas of interest. And nursing education allows students to provide hands-on care of long-term residents, providing bathing and personal care, as well as taking vital signs and feeding patients. At our school, courses can be combined into 3 different pathways. However, each school may choose to offer any of the 5 pathway options. Next slide. The therapeutics pathway provides students with the opportunity to explore therapeutic careers, such as nutrition and medical assisting. Next slide. The diagnostics pathway allows students to explore diagnostic careers such as radiology and dentistry. Next slide. And the nursing pathway allows students to explore nursing career options and become certified as a CNA or a patient care technician. Next slide. All courses that your student employees take will emphasize safety, HIPAA, professionalism, infection control, and more in order to prepare them for their future careers and real-world experiences. At Lenoir City High School, we create a personalized learning plan with the student to help them meet their goals. We use an advisory board to help us stay current with the healthcare industry, provide opportunities for students to certify in OSHA 10, patient care technician, and medical assisting, and build partnerships with the community to connect students with careers. Participating in your local school's advisory board can be a great way to start building those early connections. Next slide. During the pandemic, as you all know, everything was shut down and we had to get creative with how we did things, especially connecting students to clinical opportunities. There were a lot of no's when we tried to get back into clinical rotations. This quote inspired me. Some people see a wall and assume that it's the end of their journey. Others see it and decide that it's just the beginning. We met with Connie Martin, President and CAO of Fort Loudon Medical Center, and Tammy McLean, HR Specialist in 2021 to discuss how we could think outside the box to help meet their needs for employment and our students' needs to learn and grow. Next slide. I'll turn it over to Tammy McLean to tell us more about the development of the programs at Fort Loudon Medical Center for our high achieving students.
Tammy, I'm sorry, we can't hear you.
them and that sort of thing. But it was, to me, the opportunity for all students to be productive members of society and grow their communities. You know, that's the important part. But for our staff, it's the ability to grow their own talent. They're bringing them in at that time, you know, to build that relationship, to mold them the way that they would like them to be. And our campaign is building our community one student at a time. And you can move to the next one, Farrell. Okay, so when we did our pilot program, we did everything wrong. You know, when we looked at it, it was like, you know, what do we need to do? How do we need to get started? Do we need a policy? You know, how many students can we take? You know, do we need an application process? We had our MASH program, but how much did we want to mirror that? And really, we didn't have as much control of the program because everything was coming through the Board of Education and through the class, the host of classes and science classes. So, and if you want to go ahead. So when we sat back, what we got right is we transitioned to the work-based learning. We surveyed the students, the staff, their feedback was great. You know, what we saw, we ended the program with a celebration, and all students, you know, they presented a capstone project. You know, until we saw the capstone projects, we did not know what they absorbed, what they got out of it. And I mean, it really put us back when we heard that, you know, Sharon and I both looked at each other. It was like, they got it. They truly did benefit. They got the program. What we got wrong was everything else, everything from the application process to the orientation. We did a meet and greet. Never should have done that. We knew better, but you know, our Dennis, we love Dennis. My report to Dennis, our Chief Human Resource Officer, and he'll be joining us here shortly. But you know, that was important to him that we, you know, introduced the program to the parents with the teachers and all and the students, but it did not work. Our students did not have badge access. HR did not want to grant that to them. So we felt like if they came in to the main hospital, we're in a different building, and reported to Human Resources to collect their badges and then check in on our kiosk right outside of the Human Resources office, that would be best. Well, we didn't get to know them. It just did not work. So, you know, so many things. And then, you know, we hit the roadblock as far as the arrival times. All the public schools in Maury County are on different schedules. You know, we didn't know that. We had no idea. Once we started putting them on different, you know, the placements of where they would be, the different departments, it was after the fact that we learned that nurses can self-schedule. And then, you know, the professionalism, you know, you don't know what you don't know. And so we realized all that they didn't know. So we knew that we needed to add some type of education in there as far as what professionalism is, I'm sorry. You know, what is, you know, to dress for success. You know, how do you dress when you're preparing for an interview, and how do you prepare for an interview? How do you build your resume to sell yourself? You know, how am I going to sell myself over Sharon? You know, all of those type things. So, you know, we really had to sit back, and number one, we were relieved the pilot was over, tremendously relieved. And then number two, sit back and make note of everything that we needed to change. And then, you know, have it written down, and then meet with all the teachers involved, and everybody come to the table. And I'm a very transparent person. I mean, I put it out there. And so really that's what we did. And you can go to the next slide, Beryl. So 2023, 24, it's been great. We're getting it right. You know, and it's been wonderful. I mean, truly wonderful. We improved our processes for the application and the arrival. We actually have, you know, we totally redid the application where they have a checklist of everything they have to submit. So and at our orientation, It's students only. It's required. If you're going to be a part of the program, you're required to come to orientation. All the application, it's submitted at orientation. So we collect everything there. We basically have stations that they walk through. So, you know, we get their photos, all of that sort of thing. They have, you can see they have uniforms. They have assigned shirts that they, you know, wear, and they have certain pant colors they have to have. We did a handbook, which has everything in it. You know, they don't know how to communicate. So we kind of put the monkey on them. They're not going to be there, and Sharon, you chip in too. If they can't be there for some reason, you know, don't just call us. You know, you let people in your department know. If you are at your job, you're the one that's responsible. So we're trying to let them know. Ours are all seniors. And so, you know, what would your responsibility be if you were at work? So we've really put the monkey on them as far as what that responsibility is. You know, they have 3 options. They have 3 absences they can miss. That's it. And so they need to let us know ahead of time what those, you know, when they're going to be absent, you know, what the excuse is and that sort of thing. We've had much better turnout this time. We've had, let's see what else. Of course, they've got their handbook that has all the guidelines in it. We sat back and we reevaluated what departments we had assigned them to. We realized real quick it can't be the nursing floors. They have too many things going on. So it's the smaller departments where they can build relationships with staff. And everybody knows who their key players are. And the clinical educators has been one of the best. I mean, they are fabulous. So, you know, we've really identified those departments. But we incorporated several special programs. We did, and also individual staff members outside of us. They hear us enough. It needs to be someone different. So we did a Dress for Success. And all we told them was that we were having this, and it was all the students together all at one time. And we told them, we said, dress like you're coming for an interview. Don't wear your uniform, dress like you're coming for an interview. So it was very interesting seeing how they came dressed. Then we had a staff member that she actually had just finished building her resume, because she's actually our nurse practitioner that's over our employee health. And so anyway, so she teaches some of the nursing classes. So we had her, of course, Sharon and I haven't built a resume in years, and didn't even realize there was a new format. But so she educated them on that. We actually did puzzle pieces, and they had to work to put together how that resume would appear, and then write down exactly what they felt were the important things that they have done to put on their resume. We educated on what they would research if they were interviewing at Maury Regional. What would you look at? What would you look up about Maury Regional that you could bring to your interview? And and then we did mock interviews. So it was really, we have three students that have since been hired by Maury Regional, and they said that the mock interviews were extremely beneficial to them. So, so this was a great portion to add, and it actually built some relationships between the students too. We did a tour of the hospital. Everyone wants to be in the emergency department. We do not have any that are in the emergency department. Staff did not feel it was appropriate for them. So, but we had a great tour there. We had a great tour with our EMS system, came and showed them, talked to them all about that. We had just a tour of the entire hospital, which was wonderful. So I guess that's it pretty much for that day. But, so we have another event planned for this semester, so end of this month. And we're going to have our human resources department come in and talk to them about, how they go through the process of looking for positions here, and, that they can be hired. And then we have our First Farmers Bank is coming and going to talk to them about how they budget and how they start managing their money as they get these positions, as they take on a job. And so all of those, we're trying to build the whole, it's not, here at the hospital, we say you need to have the whole person to build, mind, body, spirit, but you've got to have everything together, for it to be successful. So, and Farrell, if you'll move to the next slide. So we do have some student hires. And what our student hires do is they are hired in as techs, but they're not officially techs at that point. And what they do is they tour each department for a 2-week period. And they can do any non-skilled tasks such as baths and call lights. Once that 2-week period has come to an end, they select which department they feel most comfortable. And the philosophy is that they will train best where they feel most comfortable. And when that training is complete, they'll go to the float pool and then they'll be pulled where they're needed. So again, we have 3 work-based learning students that are in the process. They're still in the tour portion, but we're excited about that because it shows the quality of students that we have. And we have 1 student that actually is, very timid, very not, more of an introvert, but she has actually come and talked to us, and she's interested in volunteering, and she has found an interest in imaging. So she wants to volunteer in our imaging department, and we have a staff member there that really is good about taking them under her wing. And so, for us, this is a success story because, we feel that she will be, mentored, and, we can take her under our wing, and we are hoping that our auxiliary is going to take on the role of offering, the student stipends. And so, that's kind of the plan, and we're hoping she'll be our first that we can work with. So, next slide. Some of the special programs, and of course, we've already talked about that, those things. You got the next one, yeah. So that's kind of where we are. I kind of went through it quick, but we have loved the program where the students come through our office when we changed from them going through HR. Now they come through volunteer services. They sign in. We have a little basket. We provide goodies all the time. There's always treats. We get immediate feedback for how their day went. So we are always talking with them. We've built rapport. We've built those relationships, which has been really fun. It's just made such a total difference. I think that's probably the biggest difference is the relationships.
We've learned about their personal life too, and
yeah,
they're excited when they come back if something has happened while they were there, and they'll share that.
Yeah, and that's the whole point, is that we do have those relationships. The goal is that even after the fact, when they've moved on, they will come back to us if they are looking for a position at Murray Regional, because we're hoping they'll build the relationships with staff where they can reach out to them, or they may reach out and say, Miss Cindy, Miss Sharon, can you tell me how I can get in touch with Beverly in imaging? She was a great help to me. That's what our goal is. But it's been fun. We love the program. We want it to grow, but it has just been a tremendous success. Staff loves it. So all around, it's been great all the way. So can't say enough about it.
Thank you so much, Cindy. It was really a pleasure to hear about the program when we first met. Cindy's passion around this work and around facilitating these opportunities is very inspiring. And so I appreciate you all joining us to share. We're going to try and see if we can jump to Tammy, and if she can share with us the Fort Loudoun program as well, and then we'll open it up for questions. So thank you so much. Tammy, are you with us? Can we hear you? Let's see. Okay, so it sounds like we're having a computer issue with Tammy and a patient care support. assistance program at Fort Loudon Medical Center. Apologize that she won't be able to share with us today, but we are happy to, we will try to get with Tammy and have her record her portion of the presentation, and I will obviously share that with you all. Does anyone have any questions? And I'm going to check the chat and make sure that anyone has put anything in our chat or question box for our presenters. If you are attending and have a question, please raise your hand, and we would be happy to unmute you so that you can ask whatever questions you may have for the group. Oh, here we go. Okay, Sonia Franklin has a question. Sonia, I think you're unmuted. Oh. Let me.
How about now?
There you are.
Okay. It kept saying it was muted. So my question is really a question/comment. So Jersey College just opened over into Nova Cleveland, and I'm not sure who all's on the call, but I know several of you who are in this area, this service area. And starting in the summer, we'll be launching our Jersey College Nurse Camp, which is very much the same goal here. So I would love to collaborate with those of you who are doing similar programs. I'm a big believer in collaboration, and if we can work together versus having to duplicate a lot of efforts. This is an actual curriculum that was developed by the college, so we already have it in place, but I'd be very interested to talking to anyone who would like to. We had our first kickoff meeting with our advisory board interested parties yesterday, in fact. So that's one of the reasons I wanted to join this call today, was just to hear some of the good things, and some of the questions that we had in our first meeting was really some of the first things that were talked about, like how do you deal with the age difference, and how do you get past some of the legalities and those types of things. So I would love to have further conversation with anyone who's interested. Thank you.
Thank you, Sonia. So I do have a question for the group. What would you all say is the first step? And hopefully we can hear from either Cindy or Matthew, any of our presenters today. What is the first step? If I'm an employer and I'm interested in starting a program, what is step one, and then maybe step two? But would any of you all like to share what was the first step in this process?
I'll share. I wasn't sure how to raise my hand.
No, my presenters, you all can speak freely, so go ahead.
Okay. I think the first step is just really reaching out. I mean, for us, it was really reaching out to our Board of Education, our CTE coordinator. And of course, we already had the relationship with our schools, but that was our first step. And then really coming back and getting with our, you know, of course, Dennis is our human resources. But building that base first, and then getting with our staff as to, you know, really who our champions are, who we knew would mentor the students. Because if you don't have those champions that are going to mentor them, it's not going to be successful.
All right, I was
I'll
muted.
jump
Thank
in.
you so much, Cindy.
One thing
Yeah,
I would
go
like
ahead.
to share is also, it's very important that from the business perspective, when you're looking to do work-based learning where the students are actually shadowing, interning, working, paid employment, be selfish. You have to hold the students to the same standards as you would any other employee. And the way that works is typically, especially in a paid employment position, you just have a JD, a job description. It outlines the minimum requirements, the skills that are necessary, what the work looks like, and the selection criteria. And then once you have that in mind, let's say that we need, someone we would be willing to hire 2 to 3 students to perform this task, this job, front desk, back office, lab, you name it. You then communicate what the position is, this is for paid employment, to the school, establish what the criteria will be, and then how you will select. And you allow the high school students to apply for the positions, and you interview them and vet them in the same way that you would any professional. You don't need to establish any oh, well, because it's a high school kid, I'm willing to kind of be less, I'll scrutinize this aspect of the application less than I would for someone who's 25 years old. That's not how our advanced manufacturing, construction, STEM, none of our other industry sectors do that. Therefore, you should not do that. Now, if you're hoping to expand and inform students that you may one day want to hire for paid employment, then you should establish one thing that a partner of ours, when I taught in Montgomery County, they established 9-week rotations in 4 different areas of the business. So they did some, like I said, patient intake. They did some back office work. They did some collating, filing, you name it. They did some shadowing with each different type of medical professional. And then they also worked in some billing. They had a number of different, they worked in the lab. I can't remember all of them because I'm so far removed from the classroom. It's a shame. 2017 was the last time I taught. But I remember these specific rotations in which what they wanted to inform the students of was already established. This is what it looks like. This is what you will be doing. Here are some ideal skills that you can work on. And then they also allocated time where the mentors would speak to the students about what did you observe, what questions do you have, what of these positions might interest you most, and then just speak very frankly about the good, the bad, and ugly of the position. So for an unpaid position, there's a little bit of upfront work that you need to do in terms of what you wish to show and how you wish the rotations or the experience to look. But if it's just filling a vacancy that you already have a job description for, then just tell the schools, I would like to hire for this position. It requires these skills or perhaps these credentials. If you have CNAs, they can apply. If you have people that don't have a CNA but want to get involved in healthcare, this is a position they can apply for. Here are the hours. I'll interview your students and give them a chance. But if the person from the temp agency is better suited for that position because of availability for hours, or maybe they're just a better candidate, you take that person from the temp agency over the high school student. That's going to lead to the most success.
Absolutely. Thank you so much. I appreciate the answer from both of those perspectives. We do have a question in the chat, so I will read that one from Lindsay. And Lindsay, I will unmute you so that you can also provide any type of answer. But what has been the biggest impact from the students' perspective? And did they feel that the organizations made them feel valued?
I'll speak to that one if that's okay. I went out and visited Lenoir City and got to talk with some of their students who are participating in that program. And I would say they found a lot of value in their experience there, especially in getting to work and do some hands-on patient care there at the facility. They spoke to the relationships they'd built. They spoke to the experience that they had gotten and how it helped them solidify their desire to join the healthcare field and to pursue that into their post-secondary A couple of the students that we talked with actually came back from college to talk to us, to tell us how their experience there in high school had translated now to the experience that they're having in their post-secondary. And I think it also helped them find value in the coursework that they were getting, because they were getting that hands-on experience as well. It was helping them see how that was applied, and helping them, I think, stay motivated a bit as well. And if Mark's still on, he might be able to speak more to what some of his kids were able to experience.
Sure. I was going to kind of step in a little bit for Tammy there to say that, you know, that Fort Loudon Medical actually has hired our students. So they have created not just job shadowing things, because we still have clinicals and nursing ed, but they have created paid employment opportunities. And hearing from them and hearing feedback from the hospital, it has been a really good merge of having the students being able to experience these things and find out, oh, this is what I want to do in healthcare, and try some of the different areas. But it's also made a huge difference for those hospital employees and for their patient feedback, because they, when the light goes on that, hey, I need help in my room, these kids can help jump in, and there's a list of things that 2 or 3 things they're not allowed to do, but for the most part, they can jump in and they're patient care technicians, and they can go in and help with things. And it is hearing some of their experiences, it's true world, real time patient care, and it's helped the hospital. It has helped the nurses and the other staff that's on the floors, because it assists them in their patient load. And so it's been a positive experience all around. And I also want to throw in for Tammy that she and the hospital went, that first steps were to get with their legal department, their HR department, and to work through all the red tape of how do we hire 16 and 17-year-olds. And these kids that experience things in classrooms and they're prepared, they're able to jump in, and that has given them some pride and some self-confidence, and that, yes, I can do medical work. And they're able to work over the summer, and then they're going to be able to work as they continue on into their college careers. And so it's sort of that pathway for these students to continue being employed and move up the ladder as a healthcare professional.
Yeah, I was going to chip in on that too. You know, when we had our capstone projects, what was interesting is that the students were, you don't need my webcam, but it was that some of the students were able to go in on C-sections and observe, and then observe like breast biopsies, you know, things that through our MASH program they did not get to do. And with the cath lab, they were in the cath lab, and a patient was actually just in transport and went into cardiac arrest. So they had to bring them to the cath lab. And that was actually the first day we were bringing students around. So, you know, it caused excitement. But when we had the capstone project, several of them wrote essays. And one that a student wrote was that she had gone in, she was assigned to supply chain, because they go through, I mean, no hospital could operate without their supply chain. But she had no idea of all that they did, and that she went into meetings with them and that sort of thing. So she saw how the vendors, you know, how all of that, they made contracts. And another one commented on, this is what surprised us, she actually noticed how the nurses treated the family members, not just the patient, but the family members, and the compassion that was there. And that's when I thought they really get it. They get it. So